which, if I'm going to be honest, is one of the more terrifying effects to stroke.
Is there I hate to put it this way, but the scare factor of paying attention to the prevention part is what can stroke cause as far as long term?
It's not the nicest thing, but I tell my nurses, you scare your patients when they're here, because when they leave, you want them to follow what we're telling them to do, because you want them to not revisit us. You have a small stroke. People who are listening that have had strokes, you are at a higher risk for a second stroke, higher than even if you had all the risk factors. Having that stroke elevates you even more if you do not take care of what you are going home, taking your medications that you were put on. It is so important. We can have strokes as small as numbness in a hand, you know what I mean, all the way up to something called locked-in syndrome. Which, if I'm going to be honest, is one of the more terrifying effects to stroke. So what happens is locked-in syndrome is where the person who has the stroke understands. So everything you're saying, they understand, but they can no longer move anything, breathe, talk. So they are basically, it's called locked in because they are basically locked in their body. And the only thing that they can do is understand and communicate, sometimes with blinks if they're able to. But as I was saying, all these are very scary things to have happen, and we have easy ways to prevent them. I've probably seen thousands and thousands of stroke patients, and they don't come get help in time. That is the best. We want to do prevention, but if there are risk factors, if something happens, you don't hesitate to come to the hospital.